Hello and welcome to this week's edition of NHIS in the Week. Coming up, Ejiso Dwaben District gets new NHIS office. NHIS establishes a new office at Abetifi in the Kwewu East District of the Eastern Region, and Zanzibar delegation commends Ghana's NHIS. Now to our first story. With the opening of a new district office, residents of Ejiso and Dwaben municipalities can finally access NHIS services within their vicinity. The chief of Ejiso, Nana Afrane Okese IV, generously donated a plot of land for the construction of the office in response to the municipality's request for an NHIS office. The Ejisoman Nana Afrane Okese IV, who was represented by the Odikru of Ejisoman at the brief ceremony in Ejiso to commission the building, commended the NHIA for putting up the structure for the benefit of the residents of Ejisoman and Dwabeman.
Itiemede se yeso aba na mabenye ohwe baabi a edan isi a enye hospital nko na ben se be ben edwai ben adwadifo tie den a omo nso ni bi no NHIS for mesremo omo moden na mo ne mo marante omo no de wuro obi a wunyanye card ni bi na on register e no mra na o mejoine said the bay at Achibi, Yankasa, some of ba, Sabiason, Motimia Sonasen. What's our bay Mura, Nifi, into ono Sabiason, said in the crew here no, and a Pabia would not show our baby. I am a depa, Sahadi, Jinawa, Wuha. Did the Akoso Habia, the Nissan, to mess ceremony blue, Samaba. Momra ne boko said the maba no fefefe modan fefefe montade fefefe moborofo fefefe moma bibia ne monwuma nya fefefe sa pepepe anya sa abruchiri kura no ense sa abruchiri na sabie so enimse aban na di sika be hye mboto momde ayi dwumadie emo mo ne bi wo kura sika ne timi ba enso ne ntimi nkoye de wo say a doctor from pending for head de munim de koso ward ene wo a ne ade Tiabesrem, in Casama Massam and Wama, into Tremasobana. Madame Yanamasi, Ejiname Mura Nemu, Nafrani Okisi, or Nen Najusuhima, Nanaya Santua, and Nemu, Adamu Yanamasi, Yama Makwaba, Yama Makwaba Shedding. Montua, or Jumakura, Mobeya or Hasso, or Momodina Montemon Tabamu, na Bibia, Enya Kamakama. Now, the
CEO of the NHIA, Dr. Bernardo Koboy, who commissioned the building together with management of the authority, said the authority is focused on making the scheme more sustainable and accessible to everyone.
We at the National Health Insurance are very committed to the main objective that we have, which is an objective of ensuring that every Ghanaian can walk to the hospital when they are ill. They will be taken care of by the doctor, and through the magnanimity of the state, the National Health Insurance will pay for the bills of that Ghanaian who attended the hospital.
He stated that the authority had increased the payment of tariffs to healthcare providers from 100 million to 150 million Ghana cedis every month. The upward adjustment was made due to the increased demand from service providers to increase their tariffs, as well as ensure members get continuous access to healthcare.
Every month, we pay an average of 150 million Ghana cedis. We inject 150 million into all health facilities across Ghana for attending to NHIS clients every month. This figure was about 100 million some 7 months ago. But we've increased it by close to 50% because of movement of the currency, because of inflationary pressures. Some of the hospitals told us that, increase your tariffs so that we too will not charge those holding the card.
Moving on, Dr. Okoboy said having health insurance is crucial and would come in handy in difficult times despite the few obstacles the scheme is faced with. He reaffirmed the government's dedication to preserving the NHIS.
Nana, having practiced in this country for close to 12-13 years, I can tell you that no matter what you hear, no matter the practice and behavior of people at hospitals across Ghana, the best thing for you to do is to make sure you get a health insurance card. It's the best gift Ghana has in the past 6 years of the Fourth Republic. The best gift the country has is the national health insurance. And I'm saying this because I've been in the hospital, I've seen people from very poor backgrounds who came, went through cesarean section, a procedure that will cost over 2,000-3,000 Ghana cedis. They didn't pay anything. They ate 3 times on the ward. They were there for a week, packed all their things and went home. All was paid for by the National Health Insurance Scheme.
He also expressed gratitude to Ejiso Chief Nana Afrani Okese IV for donating the piece of land to the benefits of the residents of Ejiso and Drammen municipalities.
I want to show appreciation to Nana Afrani Okese IV. This office will not be here.
Still on the commissioning of the Ejiso Drammen office, the CEO took the opportunity to advise the staff of the office to embrace a maintenance culture in order to maintain the newly commissioned office.
I have strong faith that our manager here, together with his team, will take good care of this office. We also do our best to support you now and always.
Now to the Eastern region, the CEO of the National Health Insurance Authority, Dr. Bernard Okuboy, together with some executive management and staff, has commissioned a new office for the NHIS at Abetifi in the Kwewu East district of the Eastern region. Residents of Abetifi and its environs who previously had to walk several kilometers to Impraeso to get NHIS services will now be served by this new office. In extending his operational services, the NHIS CEO expressed his gratitude to the Presbyterian Church of Ghana, the Kwewu East District Assembly, as well as the MP, Honorable Brian Echampong, for their efforts in making sure that the Kwewu East District benefited from this new office that will provide access to healthcare for its residents. He further urged residents to enroll onto the scheme and added that despite some challenges, using the NHIS should be the preferable option to pay for healthcare costs.
I'd like to acknowledge my senior brother, Honorable Brian Echampong, for all the good works. He's a man of many parts. He went to a very good school. He went to Pisek, Legon. Brian can do a lot of things. So I'll urge my district staff, get closer to him. If you get close, you don't need to come to Accra. If you look at Rock City, you should have an idea of what can happen to you. So please get close. And my own DC, Kwewu East, you have done a good job. If half of the districts in Ghana would behave like you, the present vision will come to pass speedily and in record time. Together, we can build. No one person can fix Ghana. You either get involved or you let your talk be minimal. God bless you all. Thank you very much.
Now, the NHIS board stated that management will continue to involve stakeholders in order to minimize challenges with illegal payments demanded of NHIS members at some healthcare facilities. He encouraged the public to download the My NHIS app to better understand and appreciate the benefit package offered by the NHIS.
I encourage all of us to get the National Health Insurance app. We have an app we call My NHIS. And now, once you put on your phone, you can download all the medicines that we pay for, all the services that we pay for. As long as you are armed with information, it will be difficult for someone to take advantage of you. I don't want anyone to become a medical prisoner. Now, we share documentary on TV. They said Obiko Hospital, and I detail no because Oniska. And when I was watching the TV, even one of the panelists said, "Oh, as for health insurance, day, malaria and meanwhile, almost all the surgical emergencies are covered by health insurance.
Now, the Kwewu Maria Nana Bafo Yebua Asuma, who served as the chairman of the occasion, thanked the assembly, the MP, Honorable Brian Echampong, and the management of the authority for providing a suitable office to serve his people.
Broke boy,
That's also and Churchuma Hora, they are my FR NHI app. Any information on medical and surgical procedures, let's say NHI cover. That was CP. In the be a what boss one, let me name that. That was it. And he said, if we Jumadi na more court name of Tribaya, Unya Copon. And Famonko and Kudru Jojo. Asida Cassian Manuato.
The DC for Kwewu East, Honorable Isaac Japan, who praised management for their efforts in making the office accessible to residents of Abetifi and the surrounding communities. He also expressed his determination to make the Kwewu East District Office one of the best in the Kwewu districts.
I would like to take this opportunity to extend a warm welcome to everyone who has made it to this commissioning ceremony of the Kwewu East District Office. But before I end, let me say a very big thank you to the Member of Parliament for his contribution. As we all know, this facility was constructed by the Assembly some years ago. But when it came that we have to have a district office, he volunteered to donate some monies to us to renovate this facility to put it into good use. So we say a very big thank you to the Honourable Member of Parliament for his support. I hope you have a wonderful stay, Honourable CEO, and take away some fond memories of the Kwewu East District and Abetifi when you return to your various destinations.
Moving on, a 7-member delegation from the Health Insurance Fund of the Republic of Zanzibar paid a 5-day working visit to the National Health Insurance Authority to learn about Ghana's success in the health insurance sector for the past 2 decades. The visit forms part of Zanzibar's efforts to improve its own healthcare system and provide better health insurance services to its people in order to attain universal health coverage by 2030. Now to our final story. The Corporate Affairs Directorate of the National Health Insurance Authority on Friday, 28th April 2023, organized an in-house fun-filled pre-May Day team building activities for staff of the head office and the Claims Processing Center in Accra. This exercise, which is the first of its kind, was aimed at fostering team building, relieving stress, creating an avenue for social networking, connecting and improving interactions among colleagues from different directorates and levels of the authority. Mrs. Yapokua Baden, Deputy Chief Executive Officer for Administration and HR, said the management of NHIA believed that there was a need for staff to have a sound mind and healthy body, hence the importance of participating in this corporate bonding exercise. She encouraged all staff present to constantly exercise to stay healthy and to boost productivity. Some activities that some of the staff participated in included electronic basketball, giant jagger, giant snake and ladder, a variety of board games, archery, ring toss, balloon darts, among others, and the famous flip the bottle challenge.
And so it's important that we are in good health. And for some years now, we have been participating in the city games and winning laurels in football, basketball, and volleyball. And today we are witnessing an in-house event. And I would say kudos to Jane and the team and the boss Oswald for making sure that we are seeing the mini basketball, the table tennis, the Owari, the Ludo, the archery, the PlayStations, air hockey, chess, wheels, I mean a lot of games, snake and ladder as well. So wherever you are in the authority, I wish that you will come down and be part of this because it's going to be an exciting event. And so it is our hope that at the end of it all, when the snacks also come, they will bless our souls and our bodies even as we consume it.
Now, this is how we wrap up this week's edition of NHIS in the Week. For more stories, do log on to our website, www.nhis.gov.gh, or follow us on all our social media platforms displayed on the screens. My name is Angela Siedu. Thanks for watching.